Good day, fellow champions of inclusion. I am Aaron, and this is the Inclusive Dad podcast, where we explore inclusion and make it practical. Thank you for taking time out of your busy schedule to join me in exploring ways we can create a more inclusive world together. You are important, you matter, and you can make a difference. Today, my guest is Hufsa Ahmad. Welcome to the show.
Hi, thanks for having me, AA Ron.
Absolutely. Why don't you just start us off by telling me a little bit about yourself?
Okay, well, let's see. My name's Hafsa. I am a licensed therapist who used to be an engineer, and I still identify as a scientist given that's a big part of my work. I'm also a two-time TEDx speaker. My first TED Talk, Relapse is Part of Recovery, has over 250,000 views and is featured on the official TED website. I've done behavioral health consulting. I've even done stand up comedy for 10 years, and I performed in Vancouver at an international Jewish comedy festival a few weeks ago. And I do live with, I guess, multiple disabilities at this point. I have bipolar disorder, ADHD, and chronic pain. And I've been a huge advocate both in mental health and disability communities. So I consider them equal. And I was the vice president for the board for the Dale McIntosh Center for the Disabled.
Thanks for that introduction. What is your definition of inclusion?
My definition of inclusion is being compassionate towards each other and considerate. That we're not going to say the right thing. I've definitely fumbled at I was a speaker at an independent living conference and I had a PowerPoint presentation. And before I went up, I realized oh, in my talk, I don't have a good explanation of the visuals for the people that are visually impaired or blind. And so, I started panicking. Um, and I was talking to people, and there was clear judgment and stuff. But I went up and I did the best I could. And it was definitely something I felt very embarrassed about for not being considerate. But I think at the end of the day, if you're trying, people really do actually give you the benefit of the doubt versus getting angry. So that would be my definition is just try your best to be considerate.
That's a great definition. Yeah, I kind of feel the same. I just do what I can with the information I have at the moment, and if I learn something new, then I incorporate that. But I agree. If people can see that you are trying and you are trying to do your best and accommodate people, and that way, that most people are accepting, and if you're doing your best. Yeah.
Absolutely.
Yeah, so yeah, I think we had a couple days ago we had talked, and yeah, I've done two TEDx talks, and I've listened to your TEDx talk, and I when I was listening to yours, is it what is it the title?
Relapse
Relapse.
is part of recovery.
Yeah.
Yeah.
So up until that, I had listened to that. I had only kind of equated relapse with um substances or alcohol, drugs, something like that. So yeah, when I listened to yours, I'm like, well, yeah, that makes sense. Relapse is with other things also, but I hadn't made the connection, so it was interesting. Yeah.
Yeah, I think one thing is that I wanted to make that talk broad. Like, of course, it was about my mental health story, suicidality, and a little bit about my sobriety. But the lessons that we learn based on talking to 50 people, interviewing them, is that actually there's so much similarity that if we unite over our similarities and support people who are struggling versus casting them out or feeling ashamed and isolated, my message was largely about how it could apply to everyone that, we need to treat each other well.
Yeah, absolutely. And yeah, and I have when I was going through some stuff in my life, I ended up going to it's called Celebrate Recovery, like a 12-step program, I believe, more faith-based. It was at a church that I went, but I mean, it helped me a lot in that time to, go into those room with other men and just kind of have a spot where I could talk and not be judged, and people would just listen and accept me for who I was. So I mean, that setting for me was very healing in the moment too, and I wasn't there for any kind of a substance, but some other
Hmm.
stuff. So it is a very supportive setting for sure. How is humor healing, and how can it be used in therapy?
Oh, yeah. So this is I definitely have had people being like, what humor isn't professional, like, like just a lot of skepticism. And like, not only doing stand up for 10 years, I've been sort of a little funny throughout a lot of my life. And like now I'd say I'm like much more comfortable talking with a lot of different types of people. But humor is good in therapy for basically three ways. Like the first one is that it is great for connecting with people. That like there is something about laughter that's the universal language. And I have gotten through many situations that were very precarious because I made a joke. Like I remember I think I was trying to get out of the country. I was trying to get out of Costa Rica back to the US or something, maybe vice versa. And so there was a long line and I had 30 minutes. So I was just telling people, can I go? And this couple, they just said no. They're like, yeah, we also have to go. And they just stopped me. And I was like, okay, well, I would like, I mean, can we all go? But it was awkward. And then I was talking. I remember I just made some joke. And then they were like, okay, you can go ahead. So it was just like jokes open doors and connect. And I think these days you don't necessarily want like some super flat therapist. I think the second thing is that it makes concepts accessible. So I have a lot of analogies. Like I don't know if you want to hear any of them, but a lot of them have to do with cats
Sure.
because I'm a scientist, right? And a therapist, it's like there's a lot of neuroscience that's really involved with trauma, but it's not that easy to explain. And like people oftentimes are like, why can't I get rid of these thoughts? So one of my most popular analogies is that your negative thoughts are your cat. Like your imposter syndrome is your cat. Your thing you can't get rid of is your cat. And like the cat's gonna jump at the keyboard and you're gonna be like, oh my god, I'm busy. But you have to be nice to the kitty cat because it doesn't mean harm. And also it will scratch you, much like my baby scratched my face here.
Hmm.
By accident, she loves me. And so I say, what you need, you have to acknowledge it, and you have to be kind to Kitty, and you have to push it aside. And then Kitty's gonna come back. And sometimes Kitty's more needy than others, sometimes Kitty is not, but it's your cat, and you just have to accept that and treat it with kindness. And yeah, that one's a pretty popular one because it just applies to everything. My chronic pain, my mental health. I'm trying to meditate and I can't stop thinking. It's all just mindfulness principles. And then the third thing is that healing is very helps a lot when someone is like very triggered, emotionally dysregulated. We call it, where it's just they're very anxious, fearful, stressed, angry. Like, and when you talk about trauma, it's gonna activate people, and that's part of something called EMDR therapy.
Hmm.
But humor and laughing, like you literally cannot feel a negative emotion at the same time as laughing. And like I say, my clients are funnier than me because they say some pretty wild stuff. So it's just a way to ground someone very quickly, and also I can make sure they're okay to leave session if we're kind of joking around and they seem receptive. So that's my philosophy.
Yeah, I love that. So actually, my day job, I've done some adult mental health and rehabilitation in-home stuff, and now I switched over the last couple months. I'm a co-facilitator of some DBT groups where I work. So
Nice.
haven't really done a lot with DBT before now, so I'm learning, getting into it. But we have an adolescent group, and I joke with them a lot because, I mean, I'm 48, so the slang that kids nowadays use, they're like saying phrases like slay baddie that I've never heard before. So I'm like, what the heck? So I'm like, what did you say? So I'm like making a list of these phrases, and I use humor a lot too. I just throw out like self-deprecating humor to like make fun of myself, like, hey,
Yeah.
are you guys on the Tic Tac? And just stupid stuff just to be funny. And they laugh and it puts them at ease. So I mean, I do a lot of the same stuff, but yeah. So yeah, I'm the DBT's been interesting me because I've been growing up. We didn't really talk about our emotions much at home, so just getting into it and doing a lot of the mindfulness and just now emotions are coming up, and I'm like, okay, where is that coming from? And this is like it's a weird emotion to have right now. Like, where did it come from? And it's been interesting trying to name the emotions and figure out like what's causing it, and using some of the skills, checking the facts and like different things. And it's been quite mind opening, but it's even just getting into it a little bit, I can feel myself like more mellow and stuff, or just, it's been an interesting couple months for sure. But yeah, it's kind of humor's fun to get people, get them at ease, or kind
Yeah.
of break the ice or whatever. So yeah, that's great.
What lesson do the adolescents like the most from DBT?
Well, that one's a little interesting. I do adults. I mean, co-facilitate adult groups also, which we follow like the manual much more closely. The adolescent one is kind of more. I mean, you have to be more flexible, kind of roll with the punches. It's kind of yeah, it's not. I mean, like the adult ones, we go over specific skills each week. The youth ones, it's more of a check-in and see how everybody's doing, and throw in some DBT skills here and there. So it's been that one's a little more interesting. You're trying to herd cats kind of almost more than doing stuff. But I mean, they seem to enjoy it. They like uh, I don't know. I mean, checking the facts, like the mindfulness is a little interesting because they like their phones. So you're trying to get them to do mindfulness sometimes is a little bit of a struggle. But yeah, it's been very interesting. You do DBT also?
Yeah, I'm
Or,
certified
okay,
in DBT. I led a lot of DBT groups. I'm
okay.
putting together one right now for California residents because I'm licensed in California, and it's just something that like really applies to everyone. And I think every high school should have a mandatory DBT class because yeah, it's processing and talking is one thing, but if you don't have the skills to manage your emotions or like get through crisis or be present in good times or get along with people, which are the four modules, then it's like you're just if they don't get that early, they're gonna suffer so much for the rest of their lives. Like it's early intervention, even possibly prevention, you know.
Yeah,
And so I really like that you're doing that. And I hope like you can get high schools to agree to do it more.
yeah. It's, it's definitely been interesting, but yeah, it's been fun. How can we grow in inclusive training and care?
So I think inclusivity it needs to be broadened. Like, of course, originally it was like disabilities, typically physical, because mental health was so stigmatized, and now it's becoming mental health. There's talk of multicultural, which I think that area needs to grow. Then there's neurodivergence, like different types of like background. So it's just like the way I think about it is that I constantly hear like, oh, the world is not made for blank. You know, the world's not made for ADHD or neurodivergent or this or that type of thing. And it's like, I mean, sure, the world wasn't really built in a way that it was like necessarily structured like that. Though there were instances, I forget where in the South, but they specifically made bridges so low that the buses couldn't go in them into these wealthy neighborhoods where predominantly the people using the bus were like black. And so it's like that's very much structural, the word not making it. But rather than getting caught in these like, platitudes of, no, the world's not made for you, it's just like, okay, the way we make the world more inclusive is to have everyone be empathetic and seek to understand and cut people slack. You know, like our as human beings we are hardwired to judge. It's like, oh my god, this person's late. Like, oh, they're so irresponsible. But if I'm late, I'm like, oh my god, I had so many reasons. It's that fundamental attribution error where it's just like we need to fight that. We need to, instead of making a judgment like, wow, this person doesn't know, can't take their own notes, they must be stupid, and just be like, well, maybe there's something deeper. And by the way, I am that person. After something happened in grad school, very traumatizing, I was unable to take notes in class, which was mind boggling given that I went to an Ivy League school and a top engineering college where I took notes all the time. So now people think I'm stupid whenever I need help, like taking notes. And I notice I'm better about that now that I'm not so stressed. But it's like we have to really make the effort to understand and connect instead of like discipline or judge. And that would cover all bases. That's how we make the world designed for, or will built for everyone. So yeah, what do you think?
Agree that we have to use empathy and, like, get in other people's shoes and be curious and get to know people. Yeah, because yeah, the judging thing is huge. It's just, and I feel like it's just hardwired in us, yeah, like you said, or it's just we've been taught, these we to judge people. So I have a daughter, Cecilia. She's 23 now, and she has epilepsy and cerebral palsy. So just for me, like I don't. The labels are kind of like a love-hate thing because we needed that stuff to get her, the services she needs for school and insurance and everything. But at the same time, once those labels are attached to her, you could see how it's, especially in school, like once, those labels are attached, it's like that's how she's viewed, and that's just a piece of her, or that's, one small slice of her, and there's so much more, and it's just kind of, disappointing that once that's there, people see her that way. But like I said, it's that you need that stuff to get the services, so it's kind of that's why I call it kind of a love-hate relationship.
Yeah.
So yeah.
Like, labels can be good and bad, right? Like, some
Yeah.
people, like, oh, taking on the label of neurodivergent means they can find their people and it's empowering, and I think that's great. Um, but, like, labels are not just bad, like, because if I label myself as, like, I don't know, a schizophrenic or something, that's obviously wrong in a lot of ways. But if other people do that to me too, even if I consciously know, like, I have an illness, the way people behave towards me will affect how I view myself. And so that's the kind of thing where it's like if we could broaden our understanding, and, like, in my case, like, the first mental health job I had, I was a case manager working with incarcerated folks. Everything was going great until the clinical director found out that I had mental illness. And, like, on the first day, my boss had said, "Oh, yeah, we'd love for you to share. Like, we have people in recovery, the clients would love it and stuff." But the clinical director was a pre licensed therapist who had some issues of her own. And she pulled me in the office with the boss and said, "Can you handle," or no, she said, "Can you separate being a case manager from having mental illness?" And it was just like, it was so bizarre because, first of all, I don't even know what that means. And so I was getting triggered, right? Because I get triggered when I get discriminated against. And I'm like, yes. And then I was like, where's this coming from? Did I do something wrong? And she's like, no, you didn't do anything wrong. And they're like, people say that they're worried about you offending you. So if you're offended, you have to come to us. And so it's just like, the whole office was against me for knowing I had mental illness. And my diagnosis at the time was schizoaffective disorder, which I guess is scary. And the office said a lot of bad things about people with mental health, quote unquote, dark humor so that way we don't get burnt out. And it was just like, it really damaged me. And for a year, it's just, I withdrew. I didn't want to talk to anyone, which reinforced this idea, oh, Hufsa's a bad person, or she's whatever. And, like, ultimately, I was able to turn it around. And we got to the point where when the clients left, we were on the intercom. I was making jokes, right? I was just like, tell a joke. Like, I don't know, something like, why is an elephant can't use a computer? And then people would be like, what? And I'd be like, because it's afraid of the mouse. And then people would click and go, rim shot. So, like, we definitely ended on a positive note, but it has been very damaging to have to overcome stereotypes that were placed on me despite the fact that I excel at every position I do.
Yeah, that's kind of crazy. It's coming from your boss, which she's a therapist, you said. That's just, and if she has that view of like you, like how does that affect the other people you're trying to help? Yeah, that's weird. Huh.
Yeah. And she ended up having poor boundaries herself in a lot of regards. So it's just like, it's just a repetitive thing in the field where, this field, I think people go in with good intentions, and I think some people go in to, quote, understand themselves better. And, like, I mean, graduate school, like, having mental illness, like, it was just so much discrimination in a lot of regards. And, like, I was considered a problem student. Every problem was mine. And, like, I remember, like, I would say, like, getting disciplined, I was like, this is a misunderstanding. This is not, like, what I meant. And a professor yelled at me, you think everything is a misunderstanding. And, like, I had to take an extra year because just some garbage happened, and it really broke me. And it took me many years, probably I'd say 4 years to come out to be the person I am today. So it really, really hurts to be put in boxes. And also, like, mental health boxes don't make sense. Like, the DSM was made by what? Consensus of a bunch of old white dudes? Possibly. It's like every 15 years they change the thing anyway. So it's like, why are people so attached to these labels? It's like, yo, they're going to take it away or they're going to say some BS. Or maybe people of color will join and be like, this isn't real or culturally competent. So that's my little
Yeah.
rant.
Yeah. So I mean, is there? I mean, as you're talking, is there some kind of a, I don't know, thought in the mental health community, like if you are like a provider or a therapist, like you don't have any mental health issues of yourself, or you shouldn't talk about them? Or I mean, it's interesting.
Yeah, so times are changing now.
Yeah.
Like, I mean, to give you an idea, grad school I started 2016. During our orientation, a professor stood up and said that self disclosure is unethical. And she said that she disciplined a student for telling her patient that she was going on vacation to Hawaii with her boyfriend. And so, like, I was thinking, like, oh, maybe that makes the client feel like poor or like, like self conscious or
Mhm.
whatever. And the professor was like, yeah, because she revealed that she was in a sexual relationship. And like maybe they had separate dads, but they didn't. And I was just like, I would never have ever come to that conclusion. And that when my TED talk came out, like the professor, she was a weirdo. She was like if clients see your talk, like they can't handle it. It's too much self disclosure. Like you need to tell your supervisors about your talk. And it was just a weird hyperfixation. But like now that I'm in private practice this year, like, oh yeah, lived experience is far more acceptable. People, therapists talk about it all the time. Not so much for severe mental health, but I do think it's like a shift that's really important. Like, we need, because also clients these days don't want like a weird, like blank slate therapist. They want to know about you. They want to know if you get it, type of thing.
Yeah, I mean, even from my experience in that field, I mean, you shouldn't be telling them every detail of your life, but you need to share some pieces so they can feel comfortable to. Yeah, if I'm just in the group and like my name's Aaron and don't say anything about me or anything at all, it's just that's just to me that's weird. Like how do I'm not why would I talk to somebody if they're not going to tell me anything about their life?
Yeah,
Yeah, it's
yeah.
interesting.
Yeah, I remember when I first started working at an addiction mental health treatment center last year. My first day, they're like, "Can you lead a group?" I'm like, "Of course." I stand up and I say, "I'm Hufsa," and this guy raises his hand. He's like, "Are you in recovery?" And I was like, "Yes, I am an alcoholic and I go to AA." And they're like, "Really? You don't look it." And I was like, "Then why'd you ask?" And then, it became a commonality. Like, they didn't even
Yeah.
know any more details. They just appreciated that I understood. And I don't think every therapist needs to have that necessarily to work with that population.
Mhm.
But when they saw my TEDx talk, like, they were so happy. And like I thought I was embarrassed. I didn't want them to see because I thought they'd be like, "Wow, she didn't go through anything." And my
Mhm.
coworkers showed them, and they came there like, "Oh my god, like stigma smash, like we love your story. It's so like inspirational." And I was like, "Really?" And it was just like a very strong point of connection that did not harm the therapeutic relationship at all.
Yeah. And for a while I worked at like I said, a residential facility for adolescents and the older kids. Sometimes I would show like my TEDx talk too, and I mean, it was something that, well, okay, there was one resident that actually used some of the information in there like against me when they were upset at me, but otherwise everybody it was an information point, or they knew more about me, kind of understood kind of maybe why I was in the field and how I was the way I was. So it was a good thing.
Yeah, and
How can
yeah,
how
go ahead.
can neurodivergent adults thrive in systems that were never designed for them?
Yeah, I think that question, like, I think it's a question that causes more harm than really good. And nothing against you because literally everyone says this now. Like, I had a client that she applied for disability services at her institution, and like the counselor was like, "Yeah, it's hard. The world's not made for people who are ADHD or neurodivergent." And then later, her accommodations got denied. So it's just like, I feel like we can't really put people in this victim role because people with disabilities, and I do consider neurodivergence a disability, have been doing whatever they can for a long time. And like being, I think it's really changing the attitude of victim to survivor because there's so many studies on resilience that show that mindset shift makes you less sick. It makes you not have as many cancer. I don't know what's called relapses, cancer when it comes back. And like it just makes you happier. And like another thing is like, okay, when I was on the board for the Dale McIntosh for the Disabled, the current or the previous executive director had no arms and legs. He was born with no arms and legs. So he had like leg extensions and he typed with a pencil in his mouth. Um, and so he did a great job and like how inspirational. The next executive director, she's blind. And people would always say, wow. It's like, why is that a wow? You think disabled people are stupid? The other guy who was on that board, he had ALS. He was in a wheelchair. It was very difficult, like, to understand because his disability affecting his speech. And he had the cutest doggy little golden retriever ever. And he had a law degree, and he was a professor at Chapman University. So it's sort of like, this idea of like, the world's not designed. Yeah, the world's not designed for everyone. It's never been designed for people with disabilities. We just have to figure it out. And like I know that sounds mean, but I have mental illness, ADHD, and substance use, and like I have a very very rough story. So I'm not trying to be unempathetic. I'm just trying to stop this victim mentality that's gonna hurt you. Yeah.
Yeah, I mean, I understand what you're saying because for quite a while, once we found out about inclusion, wanted my daughter to be more included. I mean, it was, trying to, the school, you should be doing this. It's a law. And then after a while, you're like, okay, this approach is not going to work. I mean, I have to do something, I have to do stuff in my life to make the world more inclusive for her where I can. And like, other people will as well. But yeah, you can't rely on other people changing everything to get it where it should be. I
Yeah.
agree with you
But I
for
do
sure.
think people should change still.
Yeah.
Like, and I think it goes back to like the compassion piece,
Hmm.
the asking questions like, if someone's struggling, like, what's the reason you're struggling instead of like disciplining. And I think it also like one thing is since the world's getting more supportive about neurodivergent as they think, which is like it's a controversial term because which most people don't know is I've been doing advocacy for 10, 15 years. At the beginning, they introduced neurodivergent as a new term for mental illness, and it never caught on, and now it became an ADHD autism thing. But somehow people with mental illness were kicked out of that word. That it's like, oh, it's now only like ADHD, autism, ADHD, and so it's just like there's a lot. Even when you're being inclusive towards neurodivergent, you're being exclusive to the rest of us who have been like disabled, have mental illness, addiction for a very long time. So I really think this wave of neurodivergence, we need to lift each other up. It's like, okay, we are neurodivergent. We need to lift the rest of the disabilities up instead of fighting like, oh, I don't like that it's called a disability. It's like, there's what's wrong with a disability? Disability is not a dirty word, like, and you can't get accommodations unless you have a disability, and it just means that you don't have the same abilities as everyone else. And they stop trying to sidestep this term disability because it's like we should have pride in ourselves. This is who we are. I'm in a wheelchair, for example. That's who I am. I'm proud of it because I can't do anything. And yes, every building should be accommodating to me, but I can't just give up and just kind of say, oh, I can't do anything because that's not how life works.
Yeah, for sure. What is one tip you can share to help the listeners be more inclusive today? So just anybody can start doing today to be more inclusive.
I would say be kind. Like a random act of kindness. It does not have to be big. It could be opening the door for someone. It could be paying for, if you're in the drive through, pay for the person in the car behind you. And I found out actually you're supposed to keep that person behind. Like, it's supposed to be like a chain to see how long you can go. It could be like smiling at people. I just smile at everyone I can because I can tell that it helps. It could be, checking in with someone, like, hey, how you're doing? Whether it's a DM or a text or phone call or whatever's the best communication. But the best way, because oftentimes we feel like we have to talk about our problems, but like, talking about problems rarely really does anything about it. Like a lot of our problems are just we can't do much about it. Like I could sit and cry about having bipolar disorder and how hard my life is, but it doesn't really do anything. That one of the 12th step of like AA and those groups is service, that it's like, oh, I'm upset. Let me call someone and ask how they're doing. Let me check in to see how they're feeling and how I can help. And that makes you feel better automatically. Much better than if you were like typing to ChatGPT and ChatGPT is being all weird and therapist to you.
Mhm.
So, kindness. Yeah.
Yeah, that's a great tip. Where's the best place for everybody to connect with you?
So you can find me on my website, hufsamod.com. Uh, it'll be, I think, in the show notes because it's kind of hard to spell. Um, and then I will be starting to do content. So uh, LinkedIn, you could find me, and YouTube. I'll be on there too. And then I'm on Instagram. Instagram a handle is Hufsa Ahmad as well. So yeah, you can email me anytime, Hufsa at hufsaahmad.com, or if you're interested in therapy or speaking, consulting, or you just want a resource or just someone to connect with. Like I do make a point to help people as much as possible within my capacity. So yeah.
Great. I'll make sure to put all that stuff in the show notes. You ready for the last question?
Yes, AA Ron.
Do you like spam lunch meat? Yes or no?
No,
That's fast.
it's pork. It's not halal.
Yeah, I know. I mean,
Yeah.
I figured that was going to be the answer, but yeah, I live near Austin, Minnesota, where they make spam and where the spam museum is located. So I've been asking everybody that I
Wow.
talk with what their answer is. It's fun to see. It's usually a fast yes or a fast no. There's not a lot of thinking about it usually, so it's been kind of
Yeah.
interesting. Yeah.
That's cute. I like that. What's your answer?
I do eat it. It's not like we eat it every meal. I mean, probably a couple times a year we'll have some slice it up, fry it with like pancakes or something. So, I mean, it's not like my favorite thing, but we definitely do eat it sometimes. So,
Do you
but
think
yeah,
spam mail, the name comes from spam, or do you think it's something else?
it's a great. I actually do not know the answer to that.
Yeah, I don't know. I didn't think about it till now because I don't know much about spam, but I heard it's a mixture of a lot of things that even seem gross, even if it's not pork. And
Yeah,
I just try to keep it real, keep it 100 healthy.
yeah,
So yeah.
yeah. It's made up of stuff that they couldn't sell other ways, is what I heard. So yeah, I don't. It's best probably not to know everything that's in there, but it's funny you said something about the email thing because I've had several times I've had spam shirts where it just says spam, like the label basically on the shirt. And there was one time I was out, I think like at a mall, and somebody asked me, "Is that the spam in a can or is that spam the email?" And I was like, "That's a really odd question." So it,
Great mind think alike. That person's a genius. I'm telling you right here, right now.
there you go. Well, thank you so much for being on the show.
Okay, thanks, Aaron.
To
All
those
right, talk
listening,
to you
thank
soon.
To those listening, thank you for allowing me to be part of your journey. It is truly an honor. Please join the podcast newsletter by clicking on the link in the episode description to keep up with the latest episodes. Together, we can make the world more inclusive. Until next time, stay empowered and be a champion for inclusion.
Stigma